You're actually working on containing an outbreak now at a new nursing home. Tell us about that.
Yes, right now we have a new outbreak. We were contacted late Thursday that a resident at the Pearl City Nursing Home, no, I'm sorry, not a resident, but a staff member at the Pearl City Nursing Home was positive. We had a strike team there within about 10 to 12 hours, and we proceeded with great cooperation from the staff at Pearl City Nursing Home to test all the residents and all of the staff. And so by yesterday morning, within about a 24-hour period, we had all the staff done immediately in hours. And then by yesterday, we had all the staff and residents done. We have 4 positive residents, and we have 2 total staff members that are positive. So we've—
Out of how many?
They have just over 100 residents at any given time at Pearl City Nursing Home. They also have up on their 4th floor, they have a contained ventilator and tracheostomy ward. So those are higher risk. So just over 100, and then just about a couple hundred staff work there.
Is it the same situation that you saw with Halanani, where you saw staff kind of going in and out, part-time workers, different places that they work at?
I believe that's common in our nursing home industry. I will have to admit, I haven't gone down into the personnel aspects of who was working. I think these 2 employees were full-timers, and I don't believe they had other outside work. I will tell you, Annalisa, that this has been handled very well. I think we're all learning from the prior experience. Immediate cooperation by the administration. They brought all hands on deck. We had numerous meetings. They cooperated with all the testing events that we put up. They immediately followed through all the protocols that we were recommending when it comes to setting up a true isolation zone, which I helped them design, moving those residents positive into a true, what we call red zone, or the quarantine ward. And the staff was all trained on infection control processes. And then because of the size of the facility, it's not as large, we're considering the entire facility an orange zone. That means it's an all isolation ward. That means you don't have the residents coming out of their rooms. You want to cohort the staff so that you don't have the staff in this nursing unit go have lunch with the unit downstairs. When you leave, you don't pass through, you leave, you go to your car, so that you're trying to create units of people that in case more positives occur, you've already taken the steps to not have transmission more broad. So we will have a full team there again tomorrow, and we'll complete an entire 300 again testing. We did have 1 resident precautionary because there was a little bit of a cough and some fever, sent to the hospital. And already, good news, we got the call from the hospital to say, let's send her back. She's stable as a rock, doesn't need to be there. So again, I can tell you, very important, we had immediate calls from Dr. Kimball, epidemiology department of health, and our contact tracing team. And so, we're bringing partnerships and cooperation to the table, and that's what we need to do to make this work for now and in the future. Any of these groups, that's what you have to do: aggressive testing, aggressive contact tracing. And so far it's going very well.
What do we know about the person who tested positive first? Did that person have symptoms and then get tested, or how did you come to discover this?
I believe the person ended up having a family member who was positive and then got tested and started to develop symptoms. Wasn't coming to work for a while, so there was a gap. It wasn't like the person was there that day and then the next day tested positive. But it's what we're seeing. It's that family member to family member, and then the transmission occurs.
Yeah, and then they maybe develop the symptoms later. And what about the others? Are they symptomatic as well?
Actually,
the ones that are positive?
Nope, all the other residents right now are stable and asymptomatic. And that's again why you have to do broad scale testing in the nursing homes and not just wait and see if people develop symptoms. You have to do, in a cluster setting like this, especially a nursing home, which can be tragic if we don't get it aggressively, immediate aggressive testing. And as you saw, we had it completed within 24 hours with, again, a lot of support from the administration, the staff. It went very smoothly, the whole process.
I have to say it's very different to what I've learned about what's happening over at Hawaii State Hospital, because I was talking to a worker there, and it doesn't seem to be kind of this confidence in what's happening, especially with the outbreak there. Do you know anything about that situation? I know you're not testing there, but I don't know if there's some insight you have on that situation.
I have actually can say that some of those positives individually came to us in our facilities when we tested them as positive, but I don't believe they have taken on the standard of care process, which generally I will tell you that in a setting like the Hawaii State Hospital, the likelihood is that it should have been handled exactly the same way. This should have been tested in 24 hours. Everyone should have been isolated, evaluated, but it just seems that there's this trickle coming out. And so I can't say. We were not called for that one. I know it's a state facility, so I think the state handles their own things, but I don't think, I mean, I'm just being, I'm going to be straightforward. I'm always straightforward with
Yeah,
you.
we know.
That, yeah, is that I need to give the state some defense for what they're doing. I was interviewed nationally. There is no Department of Health in the United States of America that was prepared for COVID. This is something that is so virulent and so infective that every Department of Health, whether it's a state level, county level, city level, they're learning as they go. Our Department of Health has really been stepping up to contact tracing. That's a very important component of this. They don't have this this whole strike team, that our group has perfected. That I'm now hired to do this across the country, and it's an important part of this aggressive on the site. Go and drop everything. We're doing it on the Big Island right now, and we're working very cooperatively with Mayor Kim and his team and their representatives over there. And we're willing to do it here, but I'm basically doing this on my own, and I'm responding to the facilities that call me. And I'm willing to work in a partnership with the Department of Health or city to do this on a regular basis. But it's just kind of more up to the facility. They're not really reaching out to us.
Well, in this case, the facility, who owns that actual Pearl City nursing home?
It's owned by a family, and
Hmm.
so I was talking to the owner and the CEO this morning, and very open. And actually, I'm straightforward. I wanted to make sure I had their approval to be talking to you guys and talking openly. But no, they're basically saying, whatever it takes, we'll do whatever it takes. They have the right attitude, and it's just cooperation all around.
Yeah, and we've been talking about this, the vulnerability of nursing homes. There was actually a hearing over at Capitol Hill last week, just talking about these very concerns, with these outbreaks coming up. Is there, I guess, what can be done to get more urgency in this in terms of, preventing these from even happening? Because I think, like you said, once it's in there, it's hard to stop the spread.
Well, as you may or may not have seen, I was testified in that. So I was very forthright to say that, as I think with you, I've been saying this in our interviews over the last 6 to 8 weeks, I'm very concerned about the group living facilities, whether it was the homeless facilities or in this case, I testified, and I will stand up and say I am still very concerned right now. Each island has to have a designated quarantine facility for intermediate care, skilled nursing, and more importantly, like for example, here on Oahu, we have 4,000 people in nursing homes. We have 8,000 in these smaller assisted living, home care where they have 3 people living in someone's private home. I can't go too far into it, but I was just made aware last night that there are another couple of positives in a small home care senior living area in the center of the island. What you should do effectively, looking at the models in the mainland, is we need to take those people immediately out of that facility and put them into a facility that is set and geared to help them. and to be watching for them to have worsening, and to be taking care of the staff who are very much at risk when you have a COVID positive. A small facility does not have the ability. Fortunately, Halinani, very well run, very effective. Pearl City, also bigger home, very cooperative management and leadership team down there. You know, we're putting it together. But what about smaller facilities? By the time, if they don't react quickly, people will die. So every island should have a facility designated preventatively ready to go. I was up on Friday. I went to Wahiwa Hospital. Fortunately, the team up there has an entire floor ready to go, prepared to do it. Our state should reach out to them right now, provide them whatever financial assistance they need to get it, the beds up and running and staffed. And it should be our designated quarantine facility, and for all of these senior care facilities. And God willing, we don't have to use it. If we don't have to use it, great, we're prepared. But why are we going to wait and then get ourselves caught flat-footed? Actually, right now, we could have been in that situation with just what happened this weekend. So the other thing is, if we have surges, another thing we're dealing with in my mainland consulting role is we're creating step-down units to take the people out of the hospital that are going to be there longer, to allow the hospital to deal with sick, critical patients. So some of these people that, you know, I'm hearing some things that make me shake my head, where people are saying, wow, the disease doesn't kill you that much. It's not bad. There's so much long-term morbidity. There's so many people that have so much lung damage and heart damage. They survive, but they may be on a ventilator for 6-8 weeks. They may have just, you know, be on oxygen the rest of their life. They may be 20 and 30 and 40-year-olds having strokes. Those people can't be transferred back into a home. They need to go to a facility to work. So we're designing those also. And that's something that the state should be considering. How do we prepare for that? We don't have any preparation at all.
Yeah, I was going to ask if we have that here. So no,
No.
we don't have it. We don't have that type of plan here right now. So how are those small facilities quarantining or isolating their people?
No answer. That's
Oh
the
no,
problem.
that's
That's
not
the
good.
problem. Like, for example, when I was down there with the Halinani outbreak, we did have a couple of positives over in Kaneohe in the same type of setting. And then what happened is, fortunately, since we had designed a quarantine wing at Halinani, they were gracious enough to accept those people from that small care home over into the Halinani wing, and they kept them and managed them until they were able to go back. That was very nice of them. But in the long term, you know, there's this push and pull where we have this not in my neighborhood type of attitude, where people don't want to see a quarantine center in their neighborhood. And then the other thing that bothers me is I feel for those organizations and their businesses, because you might have an organization say, well, I better hurry up and pull my loved one out of there because that place is full of COVID. Well, not in a well-designed quarantine center. You know, we designed the quarantine center where it had zero risk to the rest of the building. That's how you design these. You put them in areas where they just don't communicate. They don't have anything. The staff goes out stairwells. There's just no communication. So I think everybody has to understand, give credit to these organizations like Pearl City, who's willing to stand up and do the right thing. And you know, or
Be
if
proactive.
Wahiwa, be proactive, right? And if Wahiwa can step up and be willing to jump in, people need to be thanking them, not questioning, well, why is it in Wahiwa? Why do we want COVID people here? No, that's just helping the people of Hawaii. So
So the Pearl City, you have a quarantine center for the 6 that have been affected so far?
yes, we have a quarantine center designed. I have it designed right now to accommodate up to 8. That will be 4. So there's 4 residents. So it's designed just in case. I would not doubt when we go through our testing tomorrow that we get a few more conversions. And if we needed to expand it, we could expand it. But it's designed to accommodate up to 8. And so far, so good. Everybody's stable, and we're going to be all over this. And I just
So you
got my
didn't finish the testing yet, you said. So how
Oh no,
many?
no, it's all
Halfway?
done. No, we're finished. We're
Oh,
finished.
okay.
Look, we're already repeating a second round of testing at the 3-day
Ah.
mark. So at 3-day, we go through the entire facility, entire staff. Remember, you got to go through 14 days of consecutive negative tests before you consider the disease is no longer in the facility. So we are already scheduled for tomorrow and Friday. And then if Friday's all negative, we'll probably do the next Friday. And if that's negative, free and clear, the disease is out of the facility. So that's how you have to go through that 14-day cycle to just make sure. And even if it's one person, we would continue that whole testing process. And I just saw our number flashed up on my screen, 21 new cases today. So
okay, so it's not in the 40s, so that's okay.
well, it's not in the
concerning.
50, it's not in the 50s or 60s, which is even better, right? You know,
Yeah.
that's so we'll take 21. So yeah.
But you don't know if these numbers that you have are in today's total. That's not
No.
clear, right? You don't know if
Not clear. Yeah, not clear. Well, I know some of them there's no chance because they're just coming through right now. So no, there's no chance. Yeah.
Well, are you using that rapid machine that you showed us last time? Which methods are you using?
Oh no, when you do this, well, I had both machines there, but remember, need to clarify, that rapid machine is only potentially valid for people who are very sick at the time when they're spreading the antigen through their body. So again, in the field, if someone came in coughing, fever, and had active symptoms, that's a good time to use it. But at this stage, everyone is still getting the nasal PCR, the nasopharyngeal, especially in a nursing home where many of these individuals are, they're not real talkative and, they might have some memory care issues. And we basically are doing the gold standard on every single person. If I had, just for a future, if we had, an outbreak that got so bad where we started to get a lot of people who were really presenting with a lot of coughing and fever, having that in the field to quick identification, turn them right into quarantine and contact tracing, it would be effective. But at this stage, PCR is still necessary. And let me mention one more thing that I wanted to get out, that I'm probably going to bring this up to the legislature. I'm going to reach out to DOH on in the labs. I'm concerned that we do have a lag time now before we're going to get up to that essential number of tests that we could be pushing over. There has been pushback now to say, well, since we don't have tests now, we shouldn't do this preventative testing. I've been an advocate following national best practice, things that I'm following and leading the charge on in the mainland and all the other states are doing, is that you take our nursing homes and these care facilities and you test them preventatively. You don't wait for them to come positive. But right now, we have a stress on our resources. There have been discussions about a technique called pooling. This is a perfect place that I want to introduce the possibility that we move to pooling. Now, let me explain that. So let's say we have a 20, 30 resident care home, and they're on 2-3 floors. Well, what you do is you take the 10 residents on the one floor, and we do the same thing we're doing, but when it gets to the lab, they take 1/10 of an aliquot of each sample and put it into one tube that they push their machine sensitivity up, and they run one test. And if the one tube that they ran is all negative, then you don't have to run through 10 more sets of reagents to check every one of them. And if it's positive, then you have to go back and do all 10 and figure out which one is positive. But the reason that I have not been a big advocate of pooling is that pooling will be effective in the appropriate cohorts. Think about a floor of a nursing home. That's a cohort right there, right? This isn't for getting off the airplane, because when you get off the airplane, you get people come from a bunch of different states, homes, you have no idea what they're doing, and they're not common. So we may be able to stretch our resources by pooling those cohorts and those group living facilities. And I would like to introduce that this week, that we start doing pooling as a preventative measure in group living facilities throughout the state, where the people have a common path, a common number of people around. You can pool staff in that area too. That's not perfect because they do go home, but that's what we might do in the interim as we build up the possibility to get more testing capabilities.
Oh, that is an interesting idea. Is any facility really looking at that now at this point?
There's been a lot of discussion about it at the state level. Most of that discussion has been concerning maybe thinking about the visitor industry, but I don't think that, the experts that I'm dealing with and the ability to use that effectively in the visitor industry, because you have very random cohorts. I mean, we could use it maybe at a fire station. We could maybe use it at a
Yeah.
police precinct. You could maybe use it at a group where there's a common thread in those people, a family. I mean, if you had a big, broad family living under the same household, you could maybe cohort all 15 people living in a big extended family, and it might be an effective way to test. But right now, I'm concerned about senior living, group living facilities, and we need to start moving. I think we're one of the last states in the country that is not preventatively testing these people and just waiting for an outbreak to occur. We need to start getting on it.
Yeah. So was there any action that came out of last week's meeting that you testified at? Was there any concrete to-dos or what? No. Okay.
I,
That's
you
not good.
know, hey, I testified what they've done behind closed doors. I don't know. I don't
Okay.
know that. I'll try to reach out to some people to see what's going on, because they have been contacting me personally. But I think we need action now. This isn't something we should talk about and still be discussing next month. We need to increase our testing capability now, and it needs to be aggressive. I came out and said 10,000 is what we need. And we may get to a point, if you look at some of the capabilities of Germany or some of the other states or countries that are very, very effective, we may have to push our testing capability up to 25,000 tests a day. Don't
Oh, wow.
wait. Let's do it now. Let's do
Yeah.
it now. Let's
Well,
do it
the
right.
CARES Act money is still there.
Yeah, for
So,
sure.
yeah.
Yeah, for sure.
Well, Dr. Scott Miscovich, thank you again. Always good to see you. I wish it was always on better terms, but for some reason, it's always some sad news that we have to discuss. But at least you're
Well,
doing good work at the nursing home to get that contained.
well, again, I can only say we all need to kind of deal with real news. I think the people of Hawaii, they understand we're in a tough situation. And I think we all want to continue, both through the work I'm doing and the work that you guys are all doing in the media, is just give the people the truth. That's what we want. We understand it, and that's all we're looking for. And the truth is that everybody in the state knows we shouldn't open up August 1st, right? I mean, that's just not happening right now. And yes, it's challenging for the businesses, but our safety of our families and friends are first. And we need to get that number back down to where we were before we can start turning everything back on.
Yeah, understood. Well, appreciate your time. Thank
Nice to
you.
see you. Take care.